My name is Eleni O'Donovan. I'm a family doctor and I work for Unity Healthcare Incorporated in Washington, D.C. I'm also the Associate Program Director for the Family Medicine National Network, which is a teaching health center residency program with 6 sites across the nation, one of which is here in D.C. People who go into primary care are people who have some sort of experience in community health and they feel like that's their people. You sort of have that realization, this is where I belong, these are my people. But you need to get some sort of experience to make sure that's how you feel before you go into it. I think, my training had prepared me pretty well, but it's not until you're really in the setting that you kind of find out what you're made of and how you're gonna react to some of the challenges. The advice that I would give to people considering a career in primary care is to probably make sure that you're a people person. So primary care is really about relationships. Even before medical students get to residency, I think there's a lot of different ways to get some community health exposure and to start thinking about the type of site that's going to be a good match for residency. When you have your electives, choose wisely and really seek out experiences in community health and in primary care so that you're better prepared to make those choices about residency. There's a really wide range of choices for people, and the vast majority of people I know who made the NHSC commitment were able to find sites and opportunities that they were really happy with. I would try out some programs and get a sense of what the people are like, what the location is like, what living there might be like. You get a chance to talk to residents at that program. So that's a great way of setting yourself up to find a good fit. Try to do a rotation at some programs before you have to make your choice. Most programs offer what they call audition rotations. Really be an active participant in the interview process and remember that you're interviewing them as much as they're interviewing you. As someone who participates in the hiring process and does some interviews now for potential candidates, there are a few things we look for. So, experience would be an obvious one. We want people to stay at the site. You want to help the underserved. And so the providers that I work with, most of us share that experience and that level of camaraderie. And a lot of people stay after they're done with their obligation. And I think that really shows their commitment. I think being an NHSC scholar, that experience where you're really in a setting where you have to work on the fly, and sometimes if you don't have one piece of equipment, you have to come up with something else. If you can't get X medication, you have to redo your plan and come up with a medication the patient can afford. And those experiences really make you prepared to do anything in medicine.